All right, welcome back, everybody. International World AIDS Day. That is exactly what it is today. It's the 1st of December. It's a brand new week. It's a brand new month. And today is what we're doing is just, I think we are celebrating and commemorating. One way, celebrating how far we have come as a country in our AIDS programs and our awareness programs on the lives that people are leading now as they had done previously. I mean, when you think of years gone by, when we stand here at Nkosi's Haven, young Nkosi Johnson standing in front of a summit of thousands of people, of adults, decision makers, and pleading with them to please treat HIV/AIDS with respect and let people be on ARVs. And here we are broadcasting from Nkosi's Haven, where this is exactly what is being done here. A facility that is for individuals, particularly mothers and children. And you'll find there are about 121 children. We'll speak to Gail Johnson in a short while. She'll give us the exact figures and tell us a little bit more about this facility that we're broadcasting from. But let's talk more about HIV and what it's like in South Africa currently. Some of the statistics I've got here is it's showing that according to UNAIDS records, and this was back in 2011, South Africa, Sub-Saharan Africa, I beg your pardon, has got 5.6 million people living with HIV, and the disease, 270,000 related deaths. Now, to chat to us more about this, we are joined by Dr. K. Mahomed. She is an HIV clinician talking to us here on the program about how the situation in South Africa is and of course, treating people with this. It's good to have you. Thank you very, very much for being our guest on Morning Live.
Thank you so much. When you were talking about Johnson, I must say my hair stood on end. And I mean, from where we were to where we are is just phenomenal. Yeah. I have to share this with you. I have only stunning stories to tell you. I've been an HIV clinician working for Right to Care for the last 8 years, and you have no idea. I only have success stories to relate. Yeah. I'm seeing patients who are doing so well. I've followed them now for 8 years, and when I mean well, I mean they're absolutely hale and hearty. Yeah. And I follow them, and you know they're just as normal as anyone else is. In fact, I think they're going to go on to outlive myself. That's how well they're doing. Yeah. I think from where we were to where we are is just remarkable. And with all due respect, I have to thank the government for coming on board and changing everyone's views and making everything available. When I started out, we just started rolling out ARVs. And now I have to tell you, the patients in this country are getting the best care anywhere you could get in the world. We're down to 1 tablet at night only. Yeah. So please don't tell me that is difficult. I mean, I have kids who take asthma treatment and allergy treatment and whatever else. So down to 1 tablet at night is absolutely nothing. And whatever is wrong with you, we can work around it. You'll just end up taking a few more tablets, and that is it. Yeah. And it doesn't just stop there. You can have as many babies as you like, as long as you can afford them, of course. We're so on top of the TB, HIV world as well. I mean, we can tell you if you have TB within 2 hours and whether we're treating you correctly as well. So I think we're just so on top of things.
Yeah. So from your perspective, things are really getting better in terms of the treatment side. Let's talk about the infection rate, though. I mean, at one stage, South Africa had the highest infection rate in the world. I suppose maybe talking to you about statistics is not fair because that's not necessarily what you do. But from what you're seeing on a daily basis, are more and more, is the rate decreasing? Is it staying the same? Is it increasing? What are your views?
We also support clinics. And what I'm seeing happening is not everyone running to the local hospitals for care. Now that the primary healthcare nurses have picked up the HIV care for patients, people have the HIV care just at their doorsteps. Yeah. So all you need to do is to go and test, and as you test, you'll be put onto treatment. And the treatment program is so much nicer now because we've upped the CD4 to 500. So unless you don't test, you would have no clue. And if you test, you will be absolutely well, and you'll start ARVs, and you will never ever be ill because the CD4 now has been up to 500. Not just from that perspective as well. If you're in a relationship where one person is positive and one is negative, the positive partner goes on to ARVs irrespective of that CD4 to ensure the negative partner doesn't become infected. We don't just stop there. You don't just need a CD4 in a discordant couple. You can have like pneumonias and fungal infections that also put you into care. And the more people we put into care, the more virally suppressed the community immunity becomes, and this means we will transmit HIV even less.
So that's the vital thing, is to get people onto treatment, which is now, as you say, it's available, it's there. Do you run short? I know that you operate out of Helen Joseph. I mean, do you get to a situation where, we're running short here, so you'll have to go without? Or is that never a situation?
Not where I'm at. Good. Not where I'm at. Where I'm at, we've got all these things put in place that just ensure we get meds. Good. But I do, however, want to relate one other story. I think we just right there, if we get rid of the stigma that goes with HIV, and the reason I'm saying this, we've run a PMTCT program, which is prevention of mother-to-child transmission, and we've just rechanged the words now. We're calling it elimination of mother-to-child transmission. We had 1 in 4 children being born HIV positive. We've managed to reduce that stat from 25% to 2%. And this is just by putting mothers onto ARVs. Amazing. So we need to let everyone else out there know, not just the mothers, for your babies, for everyone out there. The minute you test and you treat, you will go on to live forever. So please test now, treat now, and don't delay things. Because if you do delay, you get opportunistic infections, which you don't want to, and you want to live forever.
Yeah. Let's talk about stigma, because I know it's something you didn't necessarily want to delve into, but I really do, because I think the stigma is one of the biggest challenges, because I think we've overcome the challenge of treatment, because at one stage, we can go back to our former minister who was advocating beetroot, garlic and the likes. We've gone past that. And that's where I do say that we have got a lot to celebrate. In terms of stigma, though, is there still the big label attached to it if you have HIV and AIDS and, people are aware of it, that, you look at it and you're stigmatized in a community? Or is it changing? How are your views on this?
From a clinician point of view, I'm very positive. But from looking at on the ground, how things are going, I know there's a real problem out there. And the reason I know there's a real problem out there is I work in a clinic and all the patients there are doing well. But the clinic is attached to a hospital, the Helen Joseph Hospital. And the kind of patients who come in there are patients who are really sick. So that is telling me for sure that we do have a problem. We're having a real discordancy in what is happening. The clinic patients are well, and the patients in the hospital are really, really very sick. And you're like, why are you coming in so late? Yeah. And it's all related to a stigma. So the stigma is there. As much as one has to say we are doing so well in terms of the government and the Minister of the Health and the HIV clinicians, we're on one side, but on the ground there is a real problem.
Yeah. What more needs to be done? Because, I chat to a lot of people and we see there's so many campaigns out about not being promiscuous, have protected sex, don't use needles amongst one another, and trying to do things like that. And there's a lot of education campaigns out there, but it doesn't necessarily seem to be working because the rate isn't really coming down. What do you think needs to be done? What change would you like to see happening in the communities?
I think the Department of Education and the Department of Health need to link up. I think we need to go beyond the health. I think in terms of the health things, we're on top of things. We need to educate everyone, and we need to start with our kids going through. This is, I think, where the new problem is going to lie. And the Department of Education needs to up their game and to let everyone know everything about HIV, because you must remember the mainstay of any, a success story is in education. Yeah. So if we arm kids and if we arm people with the right information, they will do the right thing. So I think we just need to go in that direction where everyone needs to know everything about HIV. And when I mean everything about HIV, it is a so treatable condition. Yeah. All the old days of stigma we need to drop behind. In the old days when you had lots of medicines and all the side effects and the body changes are all in the past. Let's take it upon ourselves to test and treat, not just to test, but to test and treat. And the treatment program is really down to 1 tablet at night, and that is it. And even if it's not 1 tablet at night and you're having like renal problems or you have TB HIV or whatever, we can work around it, but it is absolutely simple. So make yourselves available, get the medicines going, and like I say, the medicines are also the best you would ever get and the simplest you would ever get. So let's just get with it, you know what I mean? Educate ourselves, do what is right, and to all the kids out there, be smart and also not just do what is right, but do what is safe as well.
Dr. Mahomed, thank you very much for talking to us here on the program. Keep up the great work. I know that you're going to introduce yourself